This is the instructional video for the 5/6 anterior Gracey curette. So first we'll determine the correct working end. If you take a look at the handle and at the face of the blade, there's going to be one side lower than the other. You will also be able to see the face of the working end a little bit more clearly. So as you can take a look here, you can see that this side is a little bit lower than the other side. And you can kind of see a reflection off the face. And one is lower than the other. So this is going to be the cutting edge, which goes next to the tooth. Now I'm going to take this instrument, and it's going to be just like we used with the Explorer. You're going to start to the opposite side of the midline of the interproximal area you're going. So the bend is going to be away from where you're headed. Here's the midline. I'm going to start on this side with an exploratory stroke, making sure my fulcrum is close to the tooth I'm working on, but not directly under it, off to the side. And then I'm going to take a look at my grasp and make sure my grasp is good. Now I'm going to begin with an exploratory stroke, slow, rolling the handle with each stroke, keeping that lower shank parallel, finding calculus, engaging with lateral pressure. This is a subgingival instrument. Working my way up, no finger flexing, up to the contact. And then moving on to the next tooth, just starting to the side. Only lateral pressure when you discover calculus with your exploratory strokes. So this is an anterior instrument. We'll go cuspid to cuspid. Facial. Surfaces to the patient's left at 12. Then I'll take my mirror and we're going to go lingual. So I'm going to flip my instrument and I will do surfaces to the patient's left, lingual. Then I'm going to sit at 9 o'clock because all of that was at 12. I will make sure I have the correct working end. I will find the lowest edge, which is here. That goes up to the tooth, so I need to flip it here. And then I'm going to, if my patient was back farther, you could see the fulcrum a little bit more comfortably, but with it up so that you can see in the camera, my fulcrum will be here. I'll start on the other side. Again, a subgingival instrument. Engaging when I run into calculus. Dividing the surface into thirds and going up to the contact. And doing all the surfaces to the patient's right. Flipping the instrument, getting my mirror out, and I will do all the surfaces to the patient's left. Again, if I have the patient sitting back, you'd be able to see this a little bit more clearly, but the camera doesn't work that way here. Then when I'm done, I'm going to want to go line angle to line angle. And I can do that either at 12 or at 9. I prefer to do it at Well, I actually prefer to do it at 12. So then I'm going to come back and I'm going to do line angle to line angle. And do all of these. I'll do one up front here so you can see. It's kind of an oblique, like we said, a horizontal with a twist. So again, subgingival and subgingival. And then do the same thing on the lingual. You'll use like a horizontal line angle to line angle on the lingual.